Welcome to Heart with Anna, featuring your host, Anna Jaworski. Our program is a program designed to empower the CHD or congenital heart defect community. Our program may also help families who have children who are chronically ill by bringing information and encouragement to you in order to become an advocate for your community. Now, here is Anna Jaworski.
Welcome to Heart with Anna. I am Anna Jaworski and the host of Heart with Anna. We are in Season 8 of Heart with Anna. Our theme this season is Care for Adults with Congenital Heart Defects, and our show today is The Natural Course of Congenital Heart Disease. Our guest is Deena Barber. Deena Barber graduated from Kent State University with a bachelor's degree in nursing in 1983. For the last 33 years, she has worked in Akron, Ohio as a nurse, but over the last 12 years, Deena has become a subject matter expert in adult congenital heart disease care, including the natural course of congenital heart disease in adults and the challenges this unique population of survivors face. Deena's nursing passion is caring for adults living with congenital heart disease. As nurse program coordinator, she has the privilege of managing and coordinating the specialized care of adult congenital heart patients in Akron Children's Hospital. Deena believes that all adult congenital heart patients deserve expert ACHD medical and nursing care. Transition is a journey over years and includes learning how congenital heart disease may impact many areas of a patient's life. Nurses are in an exceptional position to partner with their patients as they travel through life with congenital heart disease. Welcome to Heart with Anna, Deena.
Thank you, Anna. I'm happy to be here discussing such an important topic.
It's so impressive that you have been a nurse for 33 years. You really have seen the field of nursing change in the last 33 years, haven't you?
I have. I started my career in an adult ER, and there we cared for a lot of heart patients, but it was acquired heart disease. I enjoyed the heart, but I really wanted to take care of kids. So I went to Akron Children's Hospital and began taking care of our simple cardiac patients, a unit that I was the charge nurse for. But in 2001, we started the Heart Center in the Akron Children's Hospital, and I began working there in 2002. I first began taking care of children, and then I began taking care of adults. So I've progressed from adult acquired heart disease, and I've watched adult congenital disease now come to the forefront. And I care for both our pediatric, but mostly our adult congenital patients, and I just really love this job.
That's pretty amazing that you started with adult care, and then you moved over to pediatric care, and now you're back working with adults again, but instead of acquired heart disease, it's congenital heart disease.
Mm-hmm. Mm-hmm.
We're starting to understand better and better how to prolong a healthy heart. We have so many drugs now, all different kinds of medications that help the heart to pump more efficiently and to last longer. Don't you think, Deena?
Not only do we have medications, but we have the technology for pacemakers and ACHDers. We have the cath lab procedures. Now things that used to require open heart surgery can be done in a catheter-based procedure, and patients can go home the next day. So it truly is a rapidly evolving and growing technological field. And I think it's very fortunate for our adult patients that we're starting to, I'd say, center on this population and realize we have more adults now. We really need to figure out how can we help these people get into their 60s, 70s, 80s and live a very, very natural progression for their life.
Right, right. I love to see how history tends to repeat itself, because what I had read was that really interventional cardiology was quite popularly done way back in the day. And then that kind of fell by the wayside, and instead it was all open heart, open heart, open heart. And now we've come full circle. Now we're back to doing as much closed heart as we can, because we see that that usually yields a faster recovery rate and less complications. Wouldn't you say, Deena?
Yes. Not only do you have a less recovery rate, you have less of an infection rate. Mm-hmm. You have less of a hospital stay where you can get, let's face it, there's sick people in a hospital, and the longer you stay in the hospital, the more likely you are to catch something in the hospital. So it's easier on the patient. It's cheaper, which is always a thing to be very careful with our healthcare dollars, and it leads to very good improvement in the functional status of our patients.
Right, right. So what do you think is the biggest challenge that you've faced as a professional in this field that has been growing and changing as rapidly as it has?
Now, I feel my biggest challenge is helping other medical professionals understand the complexity of our ACHD patients. They have complex medical and nursing needs, and with the growing numbers of adult congenital patients, more and more of our adult providers will encounter ACHD patients in a non-ACHD concern. Patients still have gallbladder issues. They still need their teeth cleaned. Something as simple as a dental cleaning requires an understanding of, does this patient need antibiotics beforehand? If they need their wisdom teeth removed, an outpatient procedure, a surgery, not cardiac, but you break your leg, you have, like I said, your gallbladder, your complexity really increases if you're an adult congenital heart disease patient. I believe that our nurses are in a great position to help advocate for our patients, as well as teach their patients to advocate for themselves. I always tell my patients, make sure they understand the scar on your chest indicates something very complex. Please call my healthcare team. Please talk to them about whether or not this is a safe procedure. How are we planning it? Where is it going to be? And I think that can be really tough for patients to advocate. So I tell them to turn to your ACHD team. Have them call me. Have them give us a fax. Just tell us, and we'll be very happy to explain to them why is this complex and why is this concern for us.
Oh, I just love hearing you say all of this, Deena. I just had David Franco on the show, and this is what we were talking about, especially care for adults with congenital heart disease who do need non-cardiac procedures and what considerations they have to think about that people who don't have congenital heart defects never give a second thought to. But especially if you have a pacemaker, an ICD, a whole slew of medications that you're taking, how are those medications going to interact with whatever else it is that the doctors want to do with you? I love how you say you have an ACHD team. I love that. And David talked about that too, how important it was to have a coordinated team. And that really reduced the stress for him to know that he had a whole care team taking care of him. It wasn't just one person. He wasn't the only one who had to know everything that was going on. Having that team approach made it better for everyone.
Yes, and the patient is the most important part of that team, and we really encourage our patients to advocate for themselves, to explain about their congenital heart disease, and to tell them to call us. Call us. We're there for them 24 hours a day, 7 days a week. That's pretty typical across the United States. It is a team approach with the patient as the center of that team.
I love it. I love it. That's a great place for us to take a quick commercial break. We will be right back. Don't leave yet, friends, because when we come back, we're going to talk to Deena about what children with congenital heart defects transitioning from teen to adult need to know right after this brief commercial break.
Anna Jaworski has written several books to empower the congenital heart defect, or CHD, community. These books can be found at Amazon.com or at her website, www.babyheartspress.com. Her bestseller is The Heart of a Mother, an anthology of stories written by women for women in the CHD community. Anna's other books, My Brother Needs an Operation, The Heart of a Father, and Hypoplastic Left Heart Syndrome, a handbook for parents, will help you understand that you are not alone. Visit babyheartspress.com to find out more.
Welcome back to our show, Heart to Heart with Anna, a show for the congenital heart defect community. Today's show is The Natural Course of Congenital Heart Disease, and our guest is Akron Children's Hospital Nurse Program Coordinator for the Adult Congenital Heart Service, Deena Barber. Deena, transitioning from teen to adult. Oh my goodness, this is the big challenge for people in the best of circumstances. And here we are facing a whole population of people who have congenital heart defects. Oh my goodness. So what are some of the unique challenges that this population has?
Well, not only in Akron and not only in the United States, but across the world, the most important thing I think we've all witnessed is the absolute need for our patients to fully understand the importance of lifelong care. Teens and young adults, they feel invincible. They don't want to keep going to the heart doctor. Mom and dad may have taken them as young children and teenagers. They get out on their own, and they don't want to do anything their peer group does not do. So that pressure can be really intense. But it's important for our patients to realize that we can partner with them as transition occurs. And that's not a transfer process. Transition is an educational process to prepare the adolescent to assume responsibility for their own health care, no matter who provides that care. When we don't prepare the patient, we are doing them a huge disservice, which has potentially life-threatening repercussions.
Right.
I believe it's the utmost importance to establish a trusting, open relationship with the adolescent patient so any topic can be discussed and no question gets left unasked.
Oh, I just love that, Deena.
There's so many things to discuss. You have to discuss anatomy, surgeries, the interventions that may need to be done, the medications, so much more. But if you start with that trusting relationship, then you have a foundation for that whole transition process.
I love what you said about the transition is not a place where you're going to break away from each other. Because I think that that's one of the fears, especially for us parents. Okay, I will be honest, as a parent of a child, watching this child grow up, going through 3 open heart surgeries before he became adult-aged, it's kind of scary to think about them breaking away and all of a sudden starting with a whole brand new group of people who haven't watched him go through all of those surgeries and go through untold numbers of problems, because our kids go through the normal things that children go through growing up too. And you feel so safe and secure with those pediatric people that it's scary to think of them having all of a sudden at this really crucial venture where mom and dad are not in charge of the medical records anymore. Mom and dad are not the ones who get to say yes or no. And now we're handing them off to a bunch of strangers. It's scary, Deena.
It's very scary. I go into rooms. Of course, I work at Akron Children's, and I like to think we have a pretty good model. We have our pediatric cardiologists, our adult congenital cardiologists are all on the same floor, the same area. We see patients in the same area. Oftentimes I get asked to come in by the pediatric cardiologist. Hey, I have a 15-year-old, and I know, sooner or later they're going to be an adult. Can you come in and start talking to them? And I've noticed that if we're able to start at that point, it goes a lot smoother, because I've gone in, people think, oh, that teen's not listening, parents are talking, and if we don't consider them part of the team, how are they going to ask questions? How are they going to voice concerns? Usually they're pretty well informed. They may appear disinterested, but they really are paying attention. And I really think that starting as early as 10 to 12 years old is not a bad idea. They don't have to understand everything. They don't have to be put under the microscope, but just simple as, hey, do you have any questions? Are you worried about gym class? Is there anything going on at school you want to talk about? I think if we expect them to take responsibility for their own health care, we don't want to turn it over to them at 18, 20, 21 years old and say, oh, guess what, now it's your job to do this. I think we really need to start at a very young age, and I think parents are in a really great position to be able to do that.
Well, they certainly are at a hospital like Akron Children's, where they have a team approach, and it follows the children from infancy to adulthood. Not every single hospital has that, which is a pity, because we really need that.
It is a pity, but I will tell you, my colleagues across the country that take care of adults in strictly an adult setting have done a really good job. They partner with the pediatric cardiologist in many areas. They may go to an appointment with the pediatric cardiologist so that they can help them understand who they are and why they'll be coming to the adult center. But we've got the continuity of the same people doing your echo and the same people checking you in and the same records in the same department. I think it's a pretty good model for us so far.
I think so, too. And I think we're seeing more of this across the United States, but hopefully we're also seeing this around the world. Do you hear from your colleagues from around the world, Deena, that this is also going on in other parts of the world?
I do. The United States is a great country, but we kind of are behind a little bit, especially our European and Canadian counterparts. I think a lot of that has to do with the type of insurance that a lot of these folks have. I was actually talking to a friend in Canada at a conference not too long ago, and I was lamenting the worries I have about loss to follow-up and folks that disappear. And she was sort of flabbergasted. She said, what do you mean loss to follow-up? How can you lose them? And I said, in Canada, you have a nice system where everybody is followed, everybody has access to health care, but here in the United States, it's really, really tough. The Europeans have some of the same things going on. The patients have health insurance. They're able to be followed wherever they'd like to be followed, and their records follow them. So although it's a challenge across the whole world, I think we have a special challenge in the United States because of our insurance industry.
Right. I think that's a really insightful comment, Deena.
Thank you.
What are some of the biggest obstacles that teen heart survivors face in doing this transition to adult care?
I think that's asking them to take responsibility for their own health care decisions at too late of a stage is a big obstacle for them. Like I said, at 10 or 12 years old, it's not hard to say to the patient, do you take any medicines? And they may look at me with that, oh, is this a quiz? No, I just wondered, do you take any medicines? Something as simple as that to get them to think, oh, I do take medicines. And, oh, hey, have you ever had open heart surgery? Well, I never really heard of it discussed as open heart. So I think it's a challenge that parents and the ACHD team or the pediatric cardiology team, that the challenge for the teen is that we've not included them in the discussion. And then we ask them to start making their own appointments, filling their own prescriptions. And I think nurses are in a good place to help the patient understand this is not threatening. We're not doing anything here to quiz you again, but we want you to understand that you do have some challenges. Not only are you a teenager trying to navigate the entire world, but you also have adult congenital heart disease, and we really need to help you with that. Things like finding the appropriate provider. So you're a young lady and you would like to find a primary care doctor or a gynecologist or even a dentist. I think that's a huge challenge for teens in general, but let alone if you have congenital heart disease and you need to find someone who will understand it. So again, I think the team approach is very helpful to the obstacles that the teen survivors face. And I really encourage our patients to talk to their team, ask questions, and be as informed as they can.
I love the way we keep saying team, 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 because I think one of the scariest things that we deal with as parents is feeling like we're going into this all alone. And when we realize that, no, we're not having to deal with this all alone, we actually do have a team of people there helping us, it makes you feel so much more supported and that there really is this community. And I think the internet has really helped a lot with that. Don't you agree, Deena?
I do. I very much agree. I think there are some very reputable websites out there. I think there are talks and conversations that people have with you and with some other folks out there on the internet. I think it's made the world much smaller. I know that for the care team, it's made the world much smaller. I can talk to my colleagues in the Netherlands or in Japan or Australia and ask them, hey, have you come across this? Hey, how do you handle this? Even in our own backyard, we can talk to the people around our state and say, how are things going? What kind of population are you seeing? So I think it really has changed the way people feel supported. You should feel supported by your own care team and your own area, but there's support out there all across the globe.
I love what you said.
Yeah.
So tell me, what do you think parents can do to help their teens have a healthy transition to becoming an adult heart survivor?
I think that you should include your pre-adolescent and your teen in the discussions as early as you can. Of course, tailor their involvement to their age and their developmental level. But again, it's really not hard to just say, now remember, you take how many medicines a day? If you talk about the medicines, they became just a fact of life. Hey, do you need more medicines? Hey, how about we call and make your next appointment? How about we look at your schedule? Why don't you make the phone call? If you get nervous, turn the call over to me. When we walk in the door as the healthcare team, I tend, no matter what the age of the child, I tend to ask the questions to the child. And sometimes the parents are not overly happy. And I try to explain, I'm going to ask you the question. I know you're 12. I know you're 15. I'm just going to ask you. And of course, mom or dad is here to help you. Even young children, if they've heard from a very young age that they will always need to be seen by a special heart doctor, even when they're all grown up, will come to accept it much easier than if we just spring it on you at 15 or 16 and say, hey, guess what? This is something that you're always going to do. So parents, you're the most important support system that the patient has, and you're a very important part of their healthcare team.
Oh, I love that. So over the years, I've really heard a lot of people tell me, especially people in their 40s and 50s and older, Deena, that their parents were told that they were fixed. And so all of a sudden, as they start having problems later in life, they're shocked to learn that they weren't fixed. Do you want to give a quick thought on that before we go to our next commercial?
Yeah, I think you're exactly right. And I think that if we continue to do a better and better job with transition, we're going to hear less and less of that.
Yeah, I think so too. Okay, well, we do need to take a quick commercial break, but don't leave yet, friends, because this is what we're going to talk about in the third segment. I want to hear what Deena has to say about these adults thinking that they might be fixed and our youth that are coming up that realize that they aren't fixed. So don't leave yet. We'll be right back.
Anna Jaworski has spoken around the world at congenital heart defect events, and she is available as a keynote or guest speaker for your event. Go to hearttoheartwithanna.com to learn more about booking Anna for your event. You can also find out more about the radio program, keep up to date with CHD resources and information about advocacy groups, as well as read Anna's weekly blog. Anna wants you to stay well connected and participate in the CHD community. Visit hearttoheartwithanna.com today.
Welcome back to our show, Heart to Heart with Anna, a show for the congenital heart defect community. Today's show is the natural course of congenital heart disease, and our guest is Akron Children's Hospital Nurse Program Coordinator for the Adult Congenital Heart Service, Deena Barber. And we've been talking to Deena about the transition from teen to adult heart survivor, but now we're going to talk to Deena about the natural course for adult survivors. So, Deena, now our adult congenital heart defect survivor population is at an all-time high, and it seems like there are a lot of questions regarding what parents of these survivors and the survivors themselves can expect. What do you think is the natural course for these adult survivors?
That's a tough question. So to start off with, our goal is for all of our ACHD survivors to not only survive, but we want them to thrive in their lives. We know that ACHD can't be easily put into a neat box. The natural course is difficult to predict and very different. Even if you have the same diagnosis of same structural issues, it can vary widely. But one of the biggest problems I think we all face is that our patients need to realize they're not fixed or cured. Adult congenital heart disease is a lifelong chronic disease. The disease may range from simple to moderate to highly complex, but it is still a lifelong disease. When you're a young adult, knowing you will need lifelong care can be really difficult. If you thought you were fixed or if you perhaps didn't have the best transition, it can come quite as a shock as your team tells you. We need to follow you for arrhythmia issues, for potential heart failure issues, for potential valve problems, whatever the case may be. And I think when you're young and you're starting out your career and your life, I think that's a big shock for people. Yeah. I think that your team can help you navigate all of the complexities of the problems you may face. They want to partner with you. They want to talk to you about lifestyle choices. What about your physical activity? What can I do? What should I do? Do I have any limitations? What if I want to become a pilot and I've got this really complex disease? Is that something that's reasonable for me? I really think the time to find that out is before you put your heart into it, to find out that's not really a good idea for me. I'd like to work in a factory. Is that going to be a problem? Do I have the energy for that? Is my ICD going to be a problem about that? What if I want to have a family? What about if I need to use contraception? How do I keep health insurance? Where do I get life insurance? This is a lot of topics that come up for kids and young adults, and they just get really, really complex when you have to add congenital heart disease into that. Now, when you talk about middle age, it all comes for all of us equally. Even though you might have ACHD, that doesn't mean you're immune to the effects of aging. It will happen. We want you to maintain a healthy weight. And I hardly ever use this word, but never smoke. I'm really kind of free with my patients. I'm up for whatever it is you're interested in, but never smoke. Maintain a healthy weight. Never smoke. Take your medicines and call us. I tell our patients all the time, call us. Call us if you're concerned. Call us if you're worried. It's never an imposition. That's what we're there for. In middle age, things come up. Make sure you have a PCP. You know, it's really hard for us to manage if you have gout or something along those lines because that's not what our job is. But we can partner with your PCP as some of these middle-aged issues come up. The natural course of your unique ACHD and what you can expect as you enter your 4th, 5th, 6th decades can be discussed with the team. You may have a tetralogy of Fallot and your best friend's cousin has it, but they could be two really very different diseases. So again, I know I keep pushing that, but partnering with your team to find out, what do you expect? What's the natural progression? What can I expect to face as I age even into my 70s and older? We do have patients in their 70s and 80s, and they are surviving, but they're also thriving, and that's what our goal is for you, no matter what your age is.
Oh, I just love all of that. It is different for everybody, just like people who don't have heart defects, who have normal, healthy hearts. Two people may be born the same year, both have healthy hearts, and have completely different courses in their life as far as the different things that they experience. So why should it be any different for our congenital heart defect survivors? One thing that I find interesting, Deena, as I talk with people who are entering into their middle and old age, is that they're being able to connect with other people, other survivors who have the same heart defect. Some of them even had the same heart surgery with the same doctor. Mm-hmm. And they're finding that they do have similarities around the same decades. It's not uncommon for them to start experiencing arrhythmias or for them to start experiencing other certain feelings. Have you witnessed that yourself?
I have. I hesitate to talk too much about it because I don't want folks listening to think, oh, I'm going to have an arrhythmia issue, or oh, maybe I'll have heart failure. I don't want to scare anybody, but I work in the Akron area in Ohio, and we have people in certain decades of their life, and based on how old you are and what your defect is, I can probably tell you who your surgeon was, what operation you had, how it was done, and how we expect you probably to act as time goes on. So there are definitely similarities, but sometimes there's a subtle nuance that tips somebody maybe in one way or another, or perhaps you had that surgery, but you also had something else going on at the same time. Right. So we do see things that we can talk to our patients about. We do talk to our patients about some of the same things. If you get dizzy, if you pass out, if you're having shortness of breath that seems out of proportion for the activities that you're doing. Those are pretty much across the board for most of our patients. But yeah, it is kind of funny when a patient presents and they say, I'm not really sure exactly. I know I was at this particular hospital and I was this age. Oh, well, I bet your surgeon was so-and-so and this is probably what you had done. And that's helpful if you stay in the same area. If you're not in the same area, it becomes a little more of a challenge, but it still can be tracked down, and then we can help you with what we think is going to be the natural progression or potentially some of the things we need to address.
So what do you think is the biggest challenge these adults face as they are progressing? Now they're adults looking at middle age or looking at old age.
Well, at the risk of sounding like a broken record, I think staying in ACHD care is one of the biggest problems. Finding not only ACHD care, but caregivers familiar with your congenital heart disease can be a real challenge. So what happens if you live in Montana or Alaska, where the nearest ACHD provider is 5 hours or more away from where you're at? So what we suggest is utilize your ACHD team to help you find a solution for your particular situation. Many of our patients have a local cardiologist, and then they have an overseeing ACHD provider. Visits with the ACHD team can then be coordinated with your local cardiologist so that we're not duplicating services. We only need 1 echo a year. We don't need to do 2 or 3. We don't need to do a cardiac MRI and then repeat it at a local hospital. So I just really feel like if you can stay in care in whatever way that works out for your situation, then I feel like that's the best possible way to face all of the challenges that you may come across as you age.
Yeah. Oh, I agree. That sounds fabulous. So what advice do you have for other survivors to help them have the best quality of life as they do transition through these different phases of adulthood?
I think starting as a young child and all the way through 70s and 80s is that you have to take really, really good care of yourself. It sounds like really basic kind of common sense things, but it is really important. It's important to stay in care. It's important to know why you're taking your medications and continue to take your medications. It's important to understand you're not immune to acquired heart disease, diabetes, hypertension, weight gain. You're not immune to these things. Unfortunately, it would be nice if it was that way. And if you can take care of yourself in all aspects of your life, then I think you'll have the best chance of not only surviving, but thriving into your 60s, 70s, 80s. The natural progression of your lifestyle and your life expectancy should not be limited by adult congenital heart disease if we can help it.
Okay, so one thing that we haven't talked about is exercise. So many of my friends who are in their 50s, 60s, 70s were told they can't exercise. And then they're told much, much later, oh no, you should have been exercising. Do you have any advice for those adults who, as a child, were told they couldn't exercise, but now, in order to stay limber as an older person, you really do need some form of physical fitness? What should they do, Deena?
That's a really good question because we did tend to coddle, perhaps, or I think we were just so overly concerned as a medical community. Because unfortunately, 30, 40, 50 years ago, we didn't have survivors into their 60s and 70s for the most part. So we didn't know what to tell them. So we erred on the cautious side, and we said, just kind of live your life, but don't exert yourself. Make sure you rest a lot. And I think we did a disservice to a lot of our patients, but we simply didn't know.
Right.
Now, as time has gone on, we've done a lot of research into the physical activity recommendations for people with simple, moderate, and complex disease. And there are some guidelines out there from our esteemed colleagues who have done the research. They've put people on treadmills. They've done stress tests. And I think that adult survivors are going to see that more. I think that's increased across the country in all of our centers. We're putting people on treadmills. We're putting people through metabolic stress tests, which is where they measure the oxygen consumption and the CO2 that you put out to see, are you just kind of deconditioned? Is it a lung issue? Is it a cardiac issue? And then we can show patients, hey, listen, you were able to do this activity. You had no arrhythmia. We really, really want you to do X, Y, and Z. And the new standard of care across the country is you need to give your patient a physical activity prescription. I want you to do X amount of cardio a week. I want you to do this much weights. I never want you to go above this weight. I never want you to get your heart rate higher than such and such. And we're really trying to encourage our patients, sure, walk, eat healthy, don't smoke, but I really need you to do this physical activity. And if you do it as a prescription, it really starts to carry the same weight as medication, and we take those seriously, and we need to take our physical activity prescription just as serious.
Oh, I love that, Deena. You're the first person I've talked to who has talked about an exercise prescription. I love that.
Yeah, it's very important.
Well, yeah, and it sounds to me like you're very specific My son has been told you can't lift weights like a bodybuilder, but you can lift small weights and do lots of reps.
Yes,
so you can still keep
more reps. Mm-hmm.
Right,
Yes.
so you can still keep your muscles in good condition. And we want you to know where your body is in space so you have fewer falls and things like that we worry about as we age, regardless of whether we were born with a congenital heart defect. But I love having an exercise prescription. What a great concept.
Ask your team for it. Ask your ACHD people for it. Any physical activity prescription, and that way you know what you can do, what you can't do, and then you tend to take it pretty serious because, your doctor said so. So I think it's a really good idea.
And yoga. There are certain things like yoga that we can do that really help us to stay more flexible. They help us mentally. It helps us spiritually. Just to get centered and be there and to know where your body is in space and to have some flexibility. As I'm aging, and I'm in my 5th decade now, I'm feeling that need to be flexible, know where my body is in space, and not have myself falling and hurting myself.
Mm-hmm. It's really funny you should say that. One of my physician colleagues, is a really big proponent of yoga, and he recommends it to almost every patient we have. Mm-hmm. And most of them kind of give you that face like, no, this is really good. Not only is it good for your muscles and your body, but it really is good for your stress level too.
Right. And there are different kinds of yoga. There are some yoga types that are very gentle and very easy for anybody to do. Even a beginner can do that. And then, of course, there's hot yoga and these other types of yoga.
We're not going to recommend hot yoga for most of our patients. That's probably not going to be okay. But the other yoga, definitely very, very helpful.
Oh, Deena, it has been such a delight having you on the show, and you gave us so many great pieces of advice. Thank you for coming on the show today.
Oh, Anna, thank you for inviting me. It's my pleasure and my privilege and honor to take care of this population. I believe as a nurse that this is one of the most underserved populations because there are so many people that we know about and so many more that we don't know about. And my final parting thought would be find a provider that understands your heart defect because I think it can change your life for the better.
Oh, I just love that. Absolutely. Well, that concludes this episode of Heart to Heart with Anna. Thanks for listening today. Please find and like us on Facebook and check out our website, hearttoheartwithanna.com. And remember, my friends, you are not alone.
Thank you again for joining us this week. We hope you've been inspired and empowered to become an advocate for the congenital heart defect community. Heart to Heart with Anna, with your host Anna Jaworski, can be heard every Tuesday at 12 noon Eastern Time. We'll talk again next week.